Hi, this is Fix My Fibro and my name's Bernadette. In this video, I want to talk about mast cell activation syndrome and the diagnostic criteria. So, diagnostic criteria is kind of like the rule book on how you diagnose any particular illness. So, every illness on the planet has a governed or a specified diagnostic criteria. There is usually a diagnostic test that is often known as the gold standard test, which is the best test that you should undertake to diagnose that particular illness. Because sometimes there are multiple different tests that you can do to diagnose an illness. Now, for MCAS, because it's a new condition and because there's another illness that is another mast cell disorder. So mast cells, like I said, we have them in all of our lumen, the location of it, and they also are in the bone marrow as well. But there is a condition of a mast cell disorder called mastocytosis, mastocytosis, so mastocytosis. That condition is a mast cell proliferative disorder. So that means that the mast cells just keep multiplying. Now, I don't know if you know it, but cancer is basically uncontrolled cell growth. You might not know that. That's the science nerdy thing. But when a cell, all cancer is any particular cell in your body is just mass producing, and then that cell, which is like, so for instance, the tumor, which is defined as the cancerous cells, when those cells multiply and multiply and multiply and they invade into normal tissue, that's when you've got a cancer that's spreading and then it takes over function. So let's say I've got a cancer right here in my cheek and I've got salivary glands in there. Once those cells that are uncontrollably multiplying multiply out into the cheek and affect my salivary, then I suddenly go to the doctor, I've got dry mouth. They'll look into, well, there you go. Look, you've got a cancer growing there, whether it's benign or malignant. You know all of those terms. This isn't a cancer video. It's a video about diagnostic criteria. And the issue with MCAS, the form that we have in fibromyalgia, in long COVID, in chronic fatigue, in a severe histamine intolerant setting, is that it's not the mast cell disorder of the proliferative kind, meaning we don't have mastocytosis, which is a really nasty mast cell disorder where you get lots and lots of cancers and you drop dead, among other nasty symptoms. We don't get mastocytosis. There are two enzymes in the body that they look at. Tryptase is one, and there's another one. I think it's chymosin. I can't CHY. I can't actually remember the exact name of it because we don't have that. But those two enzymes have been written in to the MCAS diagnostic criteria for diagnosis of MCAS. So when I went to go see my sixth immunologist in 20 years, and she's actually a friend or, a colleague of a dear friend of mine who is a professor of immunology at a leading research organisation here in my city. When she said, come and see my friend, she's the head of our clinical immunology. She's also a doctor. She's an immunologist. She'll help you, Bernadette. Well, of course, she ordered all these blood tests. You know what? I didn't have high tryptase. I didn't have this. I didn't have that in my blood tests. So that is a huge issue with this form of MCAS, is that the diagnostic criteria for mastocytosis, which is a mast cell disorder of a proliferative, where the cells just proliferate in the bone marrow massively, is different to mast cell activation syndrome that we have, which is a mast cell degranulation disorder. So they're both diseases of the mast cells, they're little party poppers, but, you know, the party popper kind of the mastocytosis where the enzymes are elevated. So that's why the mast cells just keep, populating and duplicating, and that turns into cancer. We don't get the cancer side. People, sure, you might get cancer independently, in a other genetic setting in your family or other things like that, but it's not that form of mast cell disorder. So this is the problem, that the diagnostic criteria, I keep saying it just about every video, it's because you're not diagnosed accurately. There are 3 parts to the diagnostic criteria. So those enzymes is the main one in the middle. Like, yep, do these blood tests, and if this happens, they've got it. Well, we don't have those high enzymes, so because we don't have that other form of mast cell disorder. The mast cell disorder we have is a mast cell degranulation disorder. So, the other 2 forms are like, if the doctor puts you on the medications and you respond to them, well, that's actually diagnostic for mast cell activation syndrome. And the first, I can't remember what the first criteria is, but it's a really wishy-washy, it's not like anything definitive. So I'm sorry, the diagnostic criteria for mast cell activation syndrome is completely inaccurate, because you can't diagnose it from a blood test unless you are doing an invasive and histological test to prove mast cell degranulation. You're not going to get diagnosed with mast cell activation syndrome. And that is the crux of the problem of fibromyalgia, chronic fatigue syndrome, long COVID, and also severe histamine intolerance, which are all now accepted as being mast cell activation syndrome conditions. It's a major problem. All I'm going to say at the very end here, I'm not diagnosed with the mast cell activation syndrome condition because my tryptase levels aren't high. It's not relevant. It's not. Some patients may have it, but it's not the mainstream. So, and I will sadly admit to this here in this video, like there's certain things I don't want to say because I don't want to be, implicated or put down by my medical peers, by the doctors and professors and immunologists and specialists out there, rheumatologists. But I have self-treated myself for 25 years. I put myself on steroids when I had severe polymyalgia rheumatica, severe temporal arthritis. My grandmother went blind from temporal arthritis, and my great aunt went blind at the age of 19. So this was like in my genetic history, my family. I wasn't going to go blind to prove to some doctor I had it, as if I'd get a diagnosis after I was blind. And a lot of you have. Let's do a video on the visual issues and stuff, and how MCAS and blindness can happen. So I've self-treated myself. I'm even now currently treating myself on the prescribed medications for stabilizing my mast cells, but that's not being prescribed by my immunologist because she hasn't diagnosed me with MCAS. So I'm going to ask her to watch all these videos. My next appointment with her is in 3 months' time, and so there'll be a lot of videos by then. She'll be really busy watching my videos in her spare time. But this is the issue. The doctors aren't diagnosing it because the diagnostic criteria and the diagnostic test are both completely not fitting into our modern diagnostic capabilities and the way we do testing for blood-based diagnostic tests or imaging or anything else. Nothing shows up because you're not doing the right diagnostic test. It's nuts. And the fact that I'm self-treating myself, that I get another doctor to write those scripts, and I manipulate the medical system to get the medication to treat what I should be on, That's absurd. I'm not condoning that. I don't want you as patients, as fibromyalgia sufferers or anyone, to go to a doctor and have to tell a lie to get the medicine you need. I want the doctors to understand this. I want the immunologists, who are the responsible, the responsible party, the responsible professional medical specialists that make the rules for these diagnostic criteria. I want you to understand it and you to write the diagnostic criteria correctly. And you've got it all wrong. You don't understand it and you don't understand the complexity of it. And that is a huge issue. It's a huge issue for all of those conditions and for all of us suffering it. And that's why we're in this diagnostic dilemma that we're in.